Okay. Who wants case
Take
two?
this one. Kind of a square punch there on the left. The other one looks like it might have been pinched just a bit.
Mm-hmm.
It looks, I mean, almost like Orpheolite just because of how
Yeah,
squared off it
that's a
is.
good point. It does.
But then there's a lot of like inflammation, especially like perivascular, periodexal, even maybe a little interface at the very top. It doesn't look like a lot of change like actually in the epidermis.
Yeah, like you said, just some kind of subtle vacuolar interface, right? Some vacuoles and rare apoptotic keratinocytes. Once it comes into focus there, a little bit of a rattiness or torn, tattered look to the basement membrane, which I find helpful to when I'm looking for a subtle interface dermatitis. Even if I don't see dying keratinocytes here, which to me is like the thing I really want to see as like the gold standard. But there are a lot of vacuoles, and there's this like really ratty appearance as opposed to the kind of more, say, more clean, like sharp line of demarcation between the dermis and epidermis here, right? This is basically
Exactly.
normal-ish. And then over here, we've got pretty decent vacuolar interface with pigment incontinence, which is another sign that we probably had interface. And there's like one dead keratinocyte there. Okay, sorry, carry on.
No, it's perfect. um, so like with these changes, I mean, you're already kind of thinking, especially with like the superficial and deep inflammation, like, oh, is this some sort of connective tissue?
Yep.
You can tell that the fat is like being replaced by like this hyalinized material, and so I think all these things kind of fit together for like lupus profunda.
Yeah, very good. Yeah, this is lupus profundus, or deep lupus, also known as lupus panniculitis. I think some people like to split that out because, it's dermpath, we got to split. And if I recall correctly, like some people will use lupus panniculitis when only the fat's involved, and lupus profundus when there's dermal and epidermal changes of lupus as well as lupus panniculitis. I don't care. I think they're basically the same thing. So in any case, sorry if anyone out there is listening and wrote a paper about this. I didn't mean to offend, but that's I remember hearing that before. Yes, so sometimes the reason of bringing that up though is that sometimes you get lucky and you get a case like this where you've got slam dunk features of lupus erythematosus in the epidermis and dermis. So interface alteration in the epidermis, superficial and deep perivascular lymphocytic infiltrate, often with plasma cells, perieccrine and maybe perifollicular lymphocytic infiltrate. You may have increased mucin, all the stuff you see in lupus. And then in addition to that, you get the panniculitis component. And so I think lupus panniculitis is really interesting because it gives you this very distinct appearance of the fat. So the fat cells are dead. Well, how do we know they're dead? They kind of look normal-ish, not exactly. One thing that's weird is that, normally fat cells are uniform in their size and shape, more or less. And here we have like big ones, small ones, medium ones. That's generally a sign something's abnormal with the fat, right? When the adipocytes are of varying size, it's a sign to at least look closer and figure out why. So the other thing is when we look here, you know what we're missing? We have a couple inflammatory cells, but there's no adipocyte nuclei, right? So that's generally a clue for necrosis. Sometimes there's a bunch of inflammation, but sometimes you get areas of necrotic fat or other things that are devoid of inflammation or have minimal inflammation. And they are the clue to necrosis is the paucity of normal nuclei of the cell type you're looking at. So in this case, the adipocytes, they're too pink, right? And in addition to them being dead, like you said, they're hyalinized, right? They have this weird mixture of like dense fibrin slash necrosis, fibrinoid necrosis, filling the spaces in between the dead adipocytes. And then additionally, you often begin to get really dense sclerosis of collagen. And like you said, it gives it that kind of firm, squared off sign that makes it look like a sharp kind of square or rectangle shape. That makes you think a little of morphia, right? In this case, part of this probably looks like morphia because it's probably on the trunk, and I feel like lupus profundus or lupus panniculitis is more common on the trunk, to my recollection. Does anyone read about this more recently? I feel like in my mind I think of it on the trunk, but maybe I'm confusing it with tumid lupus, which is usually on like the chest or upper arms,
Yeah, it's usually like upper extremities,
upper extremities. Cool,
trunk area, like upper trunk.
excellent. So kind of similar distribution to tumid lupus then. Cool. Which tumid lupus, which clinically look like kind of firm, indurated, pink or erythematous nodules or plaques. But microscopically, tumid lupus will just show you this dermal stuff. Basically, it looks like lupus in the dermis, but without the epidermal stuff and without the panniculitis stuff. So, and tumid lupus generally not associated with lupus erythematosus systemically. What about lupus panniculitis? Do any of you know about the? Clearly, I should have read more, huh? Do any of you know about the association of lupus panniculitis with systemic lupus, like what frequency it's associated? Well, I'll have to do more reading on that because I can't remember how often.
Dr. Gardner,
Yes.
I quickly Googled. I won't say that I knew this, but it
I
looks
love
like
your honesty. Bonus point. I have to look stuff up every day.
I Googled it. But it's 2 to 5% of lupus cases get lupus panniculitis, so pretty low.
So low number that get the panniculitis. I wonder though what percentage of the panniculitis patients have like SLE, like systemic involvement. I wonder. Interesting. So, because some things like you know have a high association one way, but low association the other way. Of course, you guys know that, but I remember sometimes finding that tricky as I was learning cases and diseases. But I find that fibrinoid necrosis pattern of the fat really interesting and pretty distinct for this. Then you have foamy histiocytes, xanthomatous cells, typical fat necrosis stuff, plus a lot of lymphocytes and oftentimes plasma cells. And many these lymphocytes will be a mixture of B and T cells, but oftentimes in lupus there is a more abundant component of B cells. Sometimes they can even form germinal centers, like follicles with the germinal center inside. So lymphoid follicles. I don't think we see that in this case, but that's a good thing to know about. And what's the other thing that could kind of be a potential mimic of this fat pattern? We might be seeing almost a little tiny.
The subcutaneous T cell like panniculitis T cell like lymphoma.
Yeah, good. Subcutaneous panniculitis like T cell lymphoma or panniculitic T cell lymphoma, or also known as alpha beta lymphoma. And we'll talk a little bit more about that later, but it can sometimes have very closely overlapping features with lupus panniculitis. And interestingly, some of those patients reportedly also have lupus erythematosus. And so there's maybe some debate in the literature that some cases may have been misclassified one way or the other, but there does appear to be some patients with bona fide subcutaneous panniculitis like T cell lymphoma, alpha beta T cell lymphoma that also have lupus. So there is this kind of complicated overlap, and I will, when we get to that at the end, I will talk about that and read you a little excerpt from a book that I like about some tips for telling that apart. Okay.